Pain below the kneecap, this matters. We want to make sure that we're noticing the differences between different conditions and how we go about treating them. So whether you're trying to initially take care of this at home, just because you have a little bit of ache or pain right under your kneecap, or if you're actually been dealing with this for a while and going to a professional, you want to make sure that you're being treated differently than somebody who is also dealing with knee pain, but their pain is in a different spot. Last week, we talked a lot about patellofemoral pain syndrome, and that is a big umbrella term for just pain around the kneecap. But last week, we talked about very specific pain in regards to that patellofemoral pain syndrome, which is pain or patellar tracking towards the outside, leading to pain on the outside of that knee. Now, this week, we're talking about pain right under the kneecap into the patellar tendon between where that kneecap ends and also where that little bump on your shin is. Both are going to have or cause pain with loading. Some of the mechanisms, some of the causes of that pain in regards to function throughout your day are going to be slightly different. For example, with patellofemoral pain on the outside of the knee, going downstairs may be worse than going upstairs. Patellar tendonitis can be one or the other. Generally with patellofemoral pain, it's usually the activity that gives you a problem. Meanwhile, with patellar tendonitis or patellar tendinopathy, we may notice that after we rest for a while and we start to move, there may be some achiness or some discomfort with the knee before we start loosening up and getting some more blood flow to that area, reducing some of that pain before pain returns if we do too much activity or the load is too high for the tendon to tolerate. So just again, keep in mind as you go through your rehab process, as you go through your journey of getting rid of knee pain, understand that there are differences and we want to make sure we're treating it specifically to what you're currently dealing with. So whether you're doing it on your own right now at home or you're trying to get solutions through working with a professional like myself, a physical therapist, a doctor of physical therapy who works specifically with endurance athletes and active adults, make sure you're being treated differently than somebody else who's dealing also with knee pain. If you have any questions about your knee pain, leave them down below in the comments. Make sure you like and follow, and see you in the next